Guys, today we're going to talk about Cidofovir and Probenecid and why are they given together in a combination therapy. Just a little overview about Cidofovir. So Cidofovir is an antiviral medication and is used to treat cytomegalovirus CMV retinitis in immunocompromised patients, especially those with AIDS. It works by inhibiting viral DNA polymerase. So besides the fact that it works by inhibiting viral DNA polymerase, another interesting fact about Cidofovir is that it does not require phosphorylation by viral kinases to work. So it can be given in patients who have a problem with the phosphorylation mechanism. The key issue with Cidofovir is that it causes nephrotoxicity, and it's highly nephrotoxic. It causes damage to the renal proximal tubules, and this toxicity is a major limitation to its use. Probenecid, the mechanism of action of probenecid is that it inhibits the renal tubular secretion of drugs by blocking organic ion transporters. This is very important. It blocks organic anion transporters in the proximal tubule of the kidney. By inhibiting organic anion transporters, probenecid reduces the uptake of Cidofovir into renal tubular cells, thereby decreasing its nephrotoxic effects. So the combination therapy of probenecid with Cidofovir is standard practice to protect the kidneys during Cidofovir treatment. And how this happens is that probenecid prevents Cidofovir from being concentrated in the renal tubular cells. It allows Cidofovir to stay in the bloodstream longer without high accumulation in kidney tissues, and hydration is required. You have to give adequate IV saline to reduce Cidofovir's toxicity, and it helps dilute the drug and flush out the kidneys. So the protocol is that you give 2 grams of probenecid orally 3 hours before Cidofovir use, and you follow it with 1 gram of probenecid orally at 2 hours, 8 hours after the infusion. This totals of 4 grams of probenecid per dose of Cidofovir. And hydration is by administration of 1 liter of normal saline or 1 to 2 hours before Cidofovir infusion. A second liter of saline may be infused during or after the Cidofovir infusion. So the side effects of the probenecid Cidofovir combination. The probenecid side effects: nausea, vomiting, and gastrointestinal discomfort, which is most common. Hypersensitivity reactions are rare but possible. Headache and dizziness. Cidofovir side effects include nephrotoxicity, significantly reduced with probenecid and hydration. Uveitis, very important, and neutropenia. So the key points are that probenecid and hydration are mandatory components of Cidofovir treatment regimens for minimizing nephrotoxicity. Patients should be monitored closely for renal function, example serum creatinine and urine analysis, electrolyte imbalances. Probenecid use should be avoided in individuals with a history of severe allergic reactions to sulfur drugs or conditions like gout, unless benefits outweigh risk.